Welcome to this introductory video. My name is Paul Dix, Project Principal for the UKWIR project, Common Definition and Calculation of Asset Health. My role has been to lead the Mott MacDonald project team supporting UKWIR to deliver the aims of the project. This short video is intended as a first point of contact with the project to set some context and provide a brief overview on the intent, the process we went through to deliver the project, the structure and content of the report, and the key findings and recommendations. We hope this video will give you a high-level understanding of the project and why and how you might want to engage with its outputs. Asset health is a recognised concern for the industry, with historic asset replacement rates falling short of expectations in many areas, leading to a perception of eroding asset health. It is also a subject of much discussion, from business plan submissions to Ofwat's roadmap and the Cunliffe review to research like this project. The issues that this project sought to address are that while several existing definitions of asset health existed, with a degree of commonality between them, there was a lack of alignment in how asset health was being assessed in the UK and Ireland water industry. This project aimed to produce guidance which could be commonly applied to bring greater alignment to the assessment and management of asset health. We divided the assessment of asset health into 8 subjects. Asset health definition, so to bring clear and consistent understanding to practitioners and ensure alignment. Taxonomy, a structure for classifying assets to ensure there can be comparability between organisations. Asset data, understanding the data critical to managing asset health and good practice for how to store and retain it. Asset health metrics, how to build a measure or suite of measures that assess the health of assets across the asset base and how they might be aggregated for reporting. Asset health monitoring, the techniques for monitoring asset health and how to collect asset data. Asset health interventions, how to classify asset health interventions and assess the impact of investment on health. Deterioration modelling, how to forecast change in asset health over time and how to better understand the lifespan of an asset. And finally, asset health visualization, the approach to displaying asset health information for aiding communication, comparison, and decision making. The project report is structured around these 8 subjects. Each of the first 7 subjects has a separate section within the report. The visualization section is covered in a dedicated appendix. The delivery of the project was split into 3 distinct phases. Firstly, the research phase gathered data from asset health practitioners in industry through both an in-depth survey and structured follow-up interviews. Insight was also consolidated from existing literature on topics relating to asset health, and that was researched by our partners from the University of Cambridge. The resulting research report and literature review inform the development of the framework, and these are provided as appendices to the main report. Secondly, the draft methodology phase followed a process of sequential review, where initial draft sections of the report were released to the project steering group for review and feedback. This allowed the foundations to be agreed before we built more of the framework. The final methodology phase included engagement with regulators and an industry workshop to resolve outstanding issues and challenges with the framework, leading to the final report and the project dissemination event. The scope of the project evolved a little during delivery. An original objective was to agree consistent asset life estimates, which was expanded to potentially deriving asset life estimates from triangulated common deterioration models. However, the deterioration model data returns were insufficient to achieve this. So as an alternative, the approach was adapted to develop a roadmap to recommend how this ambition could be delivered in future. So conclusions and recommendations. Understanding the health of assets has uses in both delivery within your organizations and as part of regulatory measures or incentives. We found that the same definition cannot effectively serve both uses, as the first use needs to be an accurate component of risk and resilience, and the other must account for management control. Given public and regulator attention on asset health, we recommend that the definition of asset health is aligned with the latter. To adopt a precise, measurable definition at the current level of maturity will require work to define a baseline for asset function. This might require an identification of a baseline for each asset class. Achieving a standardized taxonomy of assets to allow consistent comparison across the industry is best achieved in the short and medium term through companies maintaining a mapping of their current taxonomy to a standard, rather than changing their internal processes, which would be onerous and expensive. Further research to recommend best practice to standardize data definitions and quality, such as infill techniques for missing data like asset age, will support the comparability of asset health assessments across the industry. Within the report, we propose several asset health metrics in a 3-tier hierarchy, grouping metrics in the following way. Backwards looking. For example, historic performance data such as burst records for water mains. Current. An assessment of current likelihood of failure or proportion of expected life expired. And finally, forward-looking, a forecast of future failure rate informed by robust deterioration models. To ensure the best implementation of asset health assessment and management within your organization, we recommend the following. That you establish a written policy to define asset health, using as much of the standard approach recommended in the report as practicable, and identify clear ownership of asset health within your organization. That you commit to perform a mapping of your asset taxonomy to an industry standard, such as the proposed from the Ofwat Asset Health workstream. That your policies for asset data management, which impact the assessment and management of asset health, are reviewed and updated to align with your ambition. That you develop a continuous improvement plan for the assessment and use of asset health metrics in decision making and include your approach to visualization in this. That you assess the deterioration modeling roadmap proposed in the report and work towards its recommendations within your organization. And finally, we believe that further research into specific aspects of the assessment and management of asset health would add value to the industry, particularly as the maturity of practice within UKWIR member organizations continues to develop over time. For example, this could be research to establish best practice for missing asset data infill, leading to greater consistency in the quality of key asset health metrics. More comparable asset health metrics can enable research into comparative efficacy of asset health interventions across the industry. Greater insight into asset health interventions can then inform an analysis of an efficient asset lifecycle. The full report and appendices can be found on the UKWIR website with instructions for access on screen. Finally, on behalf of the whole project team, thank you for engaging with this research, and we hope it is of use to your organisation.